The goal to protect 1 billion people from yellow fever by the middle of this decade was ambitious enough when it was launched in 2017. That was 3 years before this happened.
The coronavirus pandemic now has a foothold in more than 140 countries.
Don't assume your community won't be affected.
Case of COVID-19.
Prepare as if it will be.
By the COVID-19 pandemic.
COVID-19 concluded this afternoon.
We are facing a global health crisis, unlike any in 75-year history of the United Nations.
Since COVID-19 emerged in December 2019, there have been over 200 million cases worldwide and over 4 million deaths. In yellow fever hotspots across the world, COVID-19 has drained precious resources, thus increasing the risk of outbreaks. Even so, 48 million people were vaccinated for yellow fever in 2020. How was that able to happen in the midst of this unprecedented event?
A miracle, but a miracle of planning and determination and courage.
I'm Nika Alexander from the World Health Organization's communications team. In this episode of Eye on Yellow Fever, we have both a global and a national perspective on how the eye strategy helped to shape the response to COVID-19.
The world owes a debt to the people who've worked on these other epidemic diseases.
The value that yellow fever vaccines have brought to the population has helped us convince people on what a COVID vaccine can do.
And how the pandemic can help fight yellow fever in the future.
More than ever before, we know it can be done because we have seen it done with COVID.
The risk of outbreaks of the deadly disease yellow fever is both significant and growing. This is down to a cocktail of contributing factors, including climate change and increasing pressure on land, greater movement of people, particularly into cities, and a resurgence in our highly connected world of the mosquito species that carries and transmits the disease. Yellow fever may not be the most obvious global public health threat, but it's a disease with no cure and a growing risk that must be taken seriously. We are Eliminate Yellow Fever Epidemics, that's I for short. From the world's most senior public health experts to those on the front line of combating this deadly disease wherever it emerges, we have the inside story on yellow fever's expanding global risk. This is Eye on Yellow Fever. The emergence of a new virus is a rare event, but perhaps not as rare as many people think. This last 20 years has seen 4 major ones. As well as the virus that causes COVID-19, there was SARS in 2002, the H1N1 flu in 2009, and Middle East Respiratory Syndrome, or MERS, in 2012. But the impact of this one is on a scale the world has not seen since the Spanish flu pandemic a century ago. For those who have lost loved ones, spent months apart from loved ones, or suffered from the disease themselves, COVID-19 has been unimaginably cruel. It has also tested the resolve of those trying to help.
Every frontline worker, every family, every community is stressed, tired, fatigued, exhausted, frustrated, and I'm just amongst those sharing the same emotions.
That's Dr. Mike Ryan. He heads the World Health Organization's Emergencies Program and is leading the response against COVID-19. Later, I'll be asking him what WHO has learned about the pandemic, the effect it's had on the fight against other diseases, and what lessons can be learned from COVID-19 as we strive to eliminate yellow fever epidemics. But let's start in West Africa, where the fight against COVID-19 is ongoing.
My name is Chikwe Ihekweazu. I lead the Nigeria Center for Disease Control in Abuja, Nigeria.
Don't assume your community won't be affected.
Case of COVID-19.
At the time we're recording this episode, there have been more than 175,000 cases of COVID-19 in Nigeria. 2,000 people have died. Dr. Chikwe says he's relieved Africa hasn't been hit by the coronavirus in the way other parts of the world have, but there's much work to do.
We're at the very early stage of our COVID vaccination efforts. I think we've covered 1% of our population.
We are facing a global health crisis, unlike any in 75-year history of the United Nations.
First question, how are you doing?
I feel a little bit like you're in a long distance race, and at some point you stop feeling the pain and you just keep running and hope that at some point you get to the finish line. But right now you are running, but you have to keep innovating because you have to keep finding ways to stay in the race.
I love that analogy of a race. When people do marathons, they talk about hitting a wall and then they push through the wall. Have you hit the wall? Have you hit many walls? Where do you think we are with respect to the wall?
Yeah, I think we've hit a few, right? We've hit a few. But we've also had a few times where it felt like this was the beginning of going downhill, right? You know, at the end of the first wave, we thought we were on top of this. We got almost to very few cases a week. Then, boom, it went up again. So there have been phases. The next one was probably when we got the first batch of vaccines in. We thought, okay, wow, now we have the vaccines. We'll have a constant stream. That hasn't happened as well. So there's been phases of, hope, anticipation, and forward movement. But every time so far, it's come back like, something has come back and some obstacles have emerged to pause the smooth transition to the end of the pandemic.
The obstacles Dr. Chikwe described are familiar to people all over the world. But actually, Nigeria is in a better position than many countries in Africa. For example, it has built up expertise in lab testing, initially designed to provide a more effective response to yellow fever.
5 years ago, we realized that, surveillance is not possible without a good lab network. People often think about it just as equipment, but there's a whole food chain around us, from bioengineering to quality assurance to training to supply chain. We focus on building all aspects of that, and it's been a journey. Sometimes, incredibly difficult, like pulling teeth, because basically it was hard to convince, it seemed in a weird way, hard to convince everyone else that this really was the bottleneck in our ability to respond.
This expertise has been used to help other countries across the region through the pandemic.
We've been providing support, especially to Anglophone West African countries, so Liberia, Sierra Leone, in helping them develop similar capabilities. These are people that have gone through the pain. They understand how to work without everything you need around you, how to achieve your goals despite scarcity of resources. And I think that's something we need to do a lot more.
The infrastructure to combat yellow fever has helped Nigeria diagnostically with COVID-19. But the success it's had with yellow fever vaccination campaigns also helped to keep COVID-19 vaccine hesitancy under control.
The value that yellow fever vaccines have brought to the population has helped us convince people on what a COVID vaccine can do in terms of preventing a disease from which there are so severe consequences.
That's interesting because my colleagues at WHO speak frequently about how countries that have had recent experience with outbreaks are the ones that have been fastest to respond to COVID. What else have you learned from yellow fever? What other practical experiences have you learned from yellow fever that have helped you in this year and a half with COVID?
Almost every aspect of it, the way the disease emerges suddenly and hides in this ecological nightmare that we still don't fully understand. The ability to sometimes disappear and reappear. And, with yellow fever, we now kind of understand these two cycles of infection. And I explained to people, how long it took for us to understand, the cycles of transmission of yellow fever and how much we expect to know about COVID in a few days or weeks, right? So these have often given us so many opportunities to learn, to compare, and use those narratives to convince a sometimes skeptical audience about COVID.
The people who work on yellow fever are the same people who are working on COVID, whether it be community members, whether it be you and your team. Do you worry that you've had to set aside yellow fever at the moment in order to focus on COVID, or you have had to do that? Does that make you worried about yellow fever?
In a way, the experience gathered from one disease has helped us with the other, but it has also distracted us from the others, right? So it's often difficult to say the pros outweigh the cons, right? But definitely last year, there was a delay in detecting some of the yellow fever outbreaks because everyone was so focused on COVID, but everything else in terms of the laboratory infrastructure, the expansion driven for molecular labs, that some for yellow fever, but also for others, that is where people got the experience that they now used for when we had to rapidly expand the COVID diagnostic infrastructure in Nigeria.
For now, thank you, Dr. Chikwe. Coming up, Dr. Mike Ryan from the World Health Organization gives us a global perspective on COVID-19 and how it can help shape our response to future epidemics and pandemics.
I think the I Partnership will learn from the COVID pandemic response about scale, about about moving fast, about how we do better negotiations with industry.
By the way, if you want to find out more about what we do, just search online for Eliminate Yellow Fever Epidemics. We've also put a link in the notes for this episode, which you'll find in your podcast app. This is episode number 3 of 10. We're releasing new episodes every 2 weeks on Fridays. If you want to get the next one straight to your phone, click subscribe or follow now. When Dr. Mike Ryan, the head of WHO's emergencies program, was learning his trade, it was the history of yellow fever he turned to.
The internet was barely alive and you had to go and look in books for references. And I remember going down into the archives and reading the old WHO histories of yellow fever and really how devastating yellow fever was as a disease and how it could move so quickly, even in a time before we had aircraft and everything else. So it always was an archetypical sort of disease for me, and how it could move into human populations and then transport itself into urban populations. And this was happening before we had all this emerging disease stuff that we talk about now. And this understanding of how disease dynamics can change and how human movement and human behavior and human population density will drive the epidemic risk. So it's just interesting to me that historically for me, a lot of my thinking around epidemics really came from sitting in the bowels of WHO, reading dusty reports of people who doing yellow fever investigations all over West Africa. So I'm really pleased that the partnership around yellow fever is so strong.
Dr. Mike Ryan has a 25-year history in tackling disease outbreaks. He's led numerous epidemic responses from the field. He's also got bitter experience of different agencies not working together.
It was just, to be honest, crazy. We'd all arrive in the field, all with the best of intent and with good people, except we'd have, too many epidemiologists, not enough lab people, no clinicians, no logisticians. And I thought, hang on, how can we just have to stop this. We have to work together better to make sure that when we do go to the field, that we go properly prepared and we actually support countries, support local NGOs and bring value. And secondly, upstream, we need to work better together to get better prepared. The people we serve are some of the most vulnerable in the world. And we have a duty of excellence and we have a duty of delivering what we promise. To do that, we have to work together.
Drawing on this experience, he became a founding member of Goran, the Global Outbreak Alert and Response Network, which has now been at the forefront of dozens of disease outbreaks around the world.
I think Goran represents a fundamentally important acceptance that allows us to work better together, and that is that no one institution can do this alone.
A theory tested to its limits by COVID-19.
We would like everyone on the planet to understand what their role is in this fight against COVID-19.
Can you just set the stage a little bit, and can you describe from what you've been able to see the impact COVID has had on health systems, on routine vaccinations and so on? What has WHO seen?
Well, huge disruption across the board, but systems had some brutal choices to make. But we know that in at least 94%, I would say 100%, but 94% of the countries we surveyed have reported, major disruption of their services. And that's across the board. It's everything, planned services, cancer services. And those disruptions haven't only been because of service delivery gaps. One of the main reasons why people reported disruption to outpatient services was the lack of public transport. You know, that was the main driver. It wasn't that the outpatients departments weren't open. It was that people couldn't get there, or people were afraid to go there, or they didn't want to mix. So there are different drivers of how the health system struggled.
So during the COVID-19 outbreak last year in 2020, 48 million doses of yellow fever vaccine were administered in Ghana, Ethiopia, Nigeria, South Sudan, Sudan, and Uganda. How did that happen? Is it because of Is it because of the importance we put on yellow fever? How was that able to happen in the midst of this unprecedented event?
A miracle, but a miracle of planning and determination and courage and commitment to the plan, and a refusal to stand back and know that if not doing those campaigns would have further created epidemic risk, and knowing how to maintain those crucial activities, and recognizing too that even in the worst of epidemics, even in the worst of crises, there's so much more we can do. So having that can-do attitude, how can we do a yellow fever campaign? How can we make it safe in the context of COVID? How can we use that campaign to raise awareness of COVID and synergize with the COVID interventions? And we've seen that during the COVID response. I know a lot of work was done to make those campaigns safe, to distribute PPE, to adapt to the reality of COVID-19, and in some ways recognize that if we were going to do the campaigns, there would have to be some adjustment, maybe some adaptation and timing, extra care to support and protect the health workers involved. Anyone who's done mass vaccination campaigns knows the difference between having vaccine and doing vaccination is planning, logistics, planning, communication, and engagement with communities. And I take my hat off to the yellow fever responders and preventers all over the world who managed to do those campaigns in extraordinary circumstances.
We've learned a lot about vaccine hesitancy related to COVID, but that's part of the work that has to happen in a yellow fever vaccination campaign as well. You don't just come into a community and say, we've got vaccines, come and get them. You have to make the case for them. The community has to understand what you're doing, who's doing it, why it benefits them, and why they should do this.
It is about vaccines, but it's also about recognizing the context in which this is occurring. And I often find that vaccine hesitancy drops when you empower people to take action themselves as well. And you put people in control and you work with the local committees who then can have some investment in all of the other things that they need as well. Because it's one thing to come in, the do-gooders of the world come in and say, we're here to help, and you vaccinate someone and you leave. But that person is still living in poverty. That person still doesn't have running water. That person's kids are still been bitten all day and all night by mosquitoes. That's the reality that a lot of people live in. So we need to be very careful when we're coming in with vertical strategies that we see the holistic needs of a community.
For countries like Nigeria, that strategy for COVID-19 is COVAX, a joint initiative among CEPI, Gavi the Vaccine Alliance, and WHO aimed at delivering equitable access to vaccines to every country in the world. Dr. Ryan says the roots for COVAX lie in the coordinated approach to yellow fever.
We've learned how to work together at smaller scale, but we've worked out the kinks, untied some of the knots. And in fact, I would say that the world owes a debt to the people who've worked on these other epidemic diseases and built these partnerships that have been practically focused on what are we focused on right now in COVAX? Equitably producing and distributing vital vaccine to populations on the basis of their need and the benefit derived, right? Well, that's exactly what I has been doing. So in that sense, the I strategy really has been one of the runways we've been able to use to have COVAX take off.
So the world, the pandemic has shown how the world is unequal, and in particular around this question of vaccine distribution. But you're saying that if we didn't have the I strategy beforehand, it would have been even more unequal.
COVAX works. Problem is COVAX doesn't have the vaccine. So the issue is not the partnership. The issue is the input. The issue is the horrific inequity and lack of understanding, quite frankly. And I put my hand to my hand because I think it's quite nuts and counterintuitive that we don't see that distributing vaccines so we can take the severe disease and the death and the hospitalization and the ICUs out of this pandemic, that then we could all return to some form of normal that we can share again, right? And the short-sightedness that getting 100% coverage of vaccine in one population is going to end the pandemic is just frankly ridiculous. The best thing we can do is get our most vulnerable, our frontline workers, all protected everywhere and make this disease into something that's more normal, more tolerable, and that won't collapse our health systems and collapse our economies every time there's a wave.
Dr. Chikwe Ihekweazu, head of the Nigeria CDC, again.
This really is a common threat, and we've got to think about it beyond our borders. The challenge is how to convince our political leaders to lead, to make hard decisions in the context of electoral cycles that are defined by a smaller group of people to whom they owe the next election to. And there have been times in history where this has been done. Yes, maybe there's a small political prize in prioritizing healthcare workers somewhere in Africa over 12-year-olds somewhere in Europe. But if that's a price we need to pay for our common global health security, maybe that's what we should be doing.
COVID-19 has changed things for all of us, how we work, how we socialize. We are only at the beginning of understanding how it has impacted global economics, global politics, global health. And as we draw this episode to a close, what do Dr. Mike Ryan and Dr. Chikwe Ihekweazu believe are the main learnings from COVID-19 that will help us in the pursuit of ending yellow fever epidemics?
I think it's going to be iterative. I think the I partnership will learn from the COVID pandemic response about scale, about about moving fast, about how we do better negotiations with industry. There's lots to be learned, and many of those organizations are in the heart of the COVID response, so they're learning lessons. So I hope we've got better and smarter and quicker and cuter when it comes to dealing with these issues.
A lot of things that we thought were impossible are actually possible. You can scale up quickly, you can start a response quickly, you can mobilize people, you can release data. We release COVID data every single evening, and we've done that for 1.5 years. So if there's one thing we can do is use this for diseases such as yellow fever, right? It mustn't take a month from the detection of a case to the delivery of vaccines. We mustn't limit ourselves to 2 labs in the country that have the capability to diagnose yellow fever. There are many things we can do more effectively, more efficiently to get on top of diseases such as yellow fever that have been with us for so long. So I think there's a cycle. COVID has been hard, is hard, but there are lessons that we will use for diseases such as yellow fever. And I think more than ever before, we know it can be done because we have seen it done with COVID.
So in a sense, what COVID-19 has done is uncovered, pulled away, ripped away the covers from what is a very unfair system of health delivery that leaves many, many of our people exposed, not just to a virus, but exposed to the consequences of having that virus. And those consequences were set up years ago because of their lack of access to good healthcare. And I think that's something that I really take away from this pandemic. It's the same. A yellow fever epidemic is a consequence. It's a consequence of not having primary vaccination. It's a consequence of living in a place that is overcrowded and you don't have access to proper water and sanitation. You don't have proper vector control. These are all consequences. We need to respond to the epidemics. We need to contain them and do all the things we do. But we also need to really think as a society about those drivers. What's driving the impact of these epidemics? And what's driving the impact of the epidemics is not just the bugs. The way we live, the way we deliver healthcare is also driving the impact of these crises.
And that's a topic we'll delve into in future episodes of Eye on Yellow Fever. My thanks to Dr. Mike Ryan and Dr. Chikwe Ihekweazu for giving us their time and their thoughts. Next time, what effect is the climate crisis contributing to the growing occurrence of yellow fever outbreaks? If you want to find out more about the I Partnership, search online for Eliminate Yellow Fever Epidemics. You'll also find the link in the show notes on your podcast app where you can click subscribe or follow to get the next episode of Eye on Yellow Fever when it's released. This episode was produced by Steve Austins with research from Amelia Jansen and sound design by Adam Whaley. I'm Nika Alexander. Eye on Yellow Fever is a Bengo Media production for Eliminate Yellow Fever Epidemics.